Morning, everyone. Dr. Mitchell. We're going to talk about emotional trauma as an etiology again, because I had an interesting case yesterday and an interesting case last week, and I was having some shower thoughts this morning and wanted to share them with you. So, young gal, insomnia for 17 years, and I wanted to know why. Where did it start? Do you know why? She doesn't know why either. She just knows that she manages it with medical cannabis and intermittent alcoholism, which is fine. Not so much the latter. Alcohol is no good for you. Cannabis, probably not the best thing in the world for you. Makes most people lazy. A select few it makes more effective, but by and large, I think it makes more people ineffective. You ever heard of allopathy? Allopathic medicine? So in naturopathy, we point our finger, we wag our finger, we scoff and scorn our allopathic colleagues, but in a lot of cases, we're allopathic ourselves. What's allopathy? So say you got pain in your foot, maybe there's a rock in your shoe, maybe there's a tack. Very unlikely that you would just be walking around with a tack in your foot, but just bear with me for the point here. Instead of removing the tack or the rock, you take an NSAID. You take ibuprofen, Aleve, Motrin, Tylenol. That would be allopathic rather than just removing the tack or the rock. Sometimes we do the same damn thing in naturopathic medicine. We call it green allopathy. Okay? And so maybe you take a bunch of curcumin or proteolytic enzymes or omega-3s or whatever instead of removing the rock or the tack. Well, that's exactly what this girl's been doing for the last 17 years. Green allopathy. She's not getting to the root of the issue. She's managing her insomnia with a bunch of weed and alcohol, which is fine, I guess. Not really. Depends on your philosophies. And if you think allopathy's bad, we need to sit down and have a 2-hour discussion over a beer. We might not get anywhere, but at least we'll have a good time. So, why? I asked why like 50 times, like a 7-year-old kid. I used to do this thing to my mom, where I'd say, Mom. She'd be like, what? And then after 5 times, she'd stop saying what, and I go, Mom, maybe a dozen more times. And then finally, she'd blow up and say, what? And then I'd say what I was going to say. But so it was kind of like that, and we got to a point where in time where she was 14 years old, and she has 2 sisters, and they both weren't fit to care for their kids because of life decisions that they made. And so she was with one of her sisters one night, helping care for her nephew, and she left her nephew with her sister for a brief moment, and the nephew died of SIDS, sudden infant death syndrome, and it was a mess. Cops came, urgent care workers came, and it was really hard for her. And that's the night her insomnia started. And after some more prodding and poking, it was very evident that she feels a lot of guilt over this, but she feels like she's processed it and doesn't think about it, and so how could it still be relevant? Well, defense mechanisms in your body and mind. And so it became evident that the way she acts out in the world and behaves is very much related to this event that happened when she was 14. She's very passionate about caring for kids. A lot of the professions she's been involved in have been related to caring for kids and getting them into appropriate arms, and she has a very strong attachment to her nieces and nephews, very much atypical for a gal her age. I guess it's not so atypical because women are more nurturing, but I gotta say, most gals her age aren't looking after their niece as vigilantly as she is. And so, yes, some clear patterns here, which she is, which likely explain her insomnia, which she is managing with cannabis and intermittent alcohol. So it was kind of an aha moment for her, and she realizes it's something she needs to explore more and could be the key to freeing herself from chronic cannabis use and intermittent alcoholism. So something really important to think about. And it's something I hear all the time when I'm taking histories. I learned that just before the eruption of autoimmune disease, events like this may have happened. And we can argue and dispute whether it's just stress unearthing something on an already weak foundation. But what makes it more evident that it's unlikely just stress unearthing something versus something you're carrying and hanging on to is the patient's total health history. The patient's total health history. And so when we're chronicling things from coming out of the womb to where the individual is now, they're generally healthy and without any issues prior to the lead up to whatever it is they're dealing with now. It's very likely it was more than just stress unearthing things. So do consider this, please, this deep etiologic factor. There's a highlight with the heading Etiology that you should check out if you want a more fluffier, sorry, it's early in the morning and I'm dehydrated, fluffier explanation of this. Alright, I gotta drive now. Dr. Mitchell signing off. Everybody be safe. We'll talk again soon. Bye-bye.